I was really excited to come out here and work because I know that we have such a large patient population on this end of town, and I'm really looking forward to being able to provide patients care in their neighborhood.
As we've been brainstorming, how can primary care be different? How can it be better? This is our chance to really put that into practice and try some really new, exciting ways of delivering primary care.
The neighborhood is growing up around this location. It makes it more convenient for people not to have to go to the other side of Bozeman.
This area, is where a lot of young families are settling, and with the new high school being nearby, lots of families here.
Knowing that a lot of people work or have other obligations, we've expanded our morning and evening hours to meet those needs.
We'll have physicians available from 7 in the morning until 7 at night, as well as 8 to 5 on Saturdays. And hopefully that will provide better access for our patients.
The idea of telemedicine has really taken off in the last year with the pandemic, but this will be a critical arm of our care delivery at Cottonwood. Telemedicine allows someone to schedule an appointment and not necessarily have to step out of their whole day or schedule their whole day around coming to a doctor's office. That's a big chunk of time for a working family or for a child missing school or for someone having to step out of their job.
Patients will notice a lot of technology here that they've maybe not seen in other places. So we're really trying to leverage the technology here to help us streamline the experience and make things more convenient for patients.
Guests come in, can schedule their own appointments, can be seen sort of when and how they want to be seen. The second technological advance is something called Visit Valet, which will allow staff members and colleagues to anticipate a patient's needs as they come up.
From check-in at the front desk through the actual visit with the provider, we can see where they are in the building so we can anticipate when we can move to the next step with them. We're going to be able to have integration between the scales. We're working on integrating the vitals so that those things automatically go into the electronic medical record. All of those things saving time in the process for the nurses and then giving more time with the provider.
The idea for having multidisciplinary services available at this clinic is that if you're a family that lives in the area or a person that works in the area, hopefully you can get all the things that you need to get done right at this building. So for instance, if you need to get blood work done, see your primary care provider, get a colonoscopy, or have a same-day surgery done, a lot of those things should be able to be done right here at the Cottonwood Clinic.
We're going to have a real team approach to our care where everyone from the front desk person all the way to the nursing staff, the provider, the lab team is all going to be working together to provide our patients with the best care possible.
I'm there to support them, guide, educate, be their advocate for their treatment or illness that they are dealing with. Patients really do like it. They are able to talk to one person. They don't have to retell their story to every nurse that they talk to. They already know that I know their story and what we are trying to accomplish, so it does make it easier for them.
We have a licensed social worker who will be able to help us with patients in clinic to help them to get acute services that they need.
You can make an appointment with me in conjunction with a physician appointment, and we can really tackle the whole patient perspective of care, including the mental health piece.
I think one of the key selling points for me as a provider at Cottonwood Clinic is the ability to collaborate with my colleagues in family medicine and internal medicine.
We aren't going to be practicing in silos, so if there were a family where maybe the pediatricians were caring for the children and one of us was caring for grandma or grandpa, there could be some information sharing and some collaboration for that family behind the scenes to really optimize the way that we take care of that whole family unit. We really have chosen a team of outstanding people.
We're really hoping that our whole team is able to provide that comprehensive care that's so important to primary care, and really that will help make our relationship as a provider with the patient much greater.